Well, you've heard us talk about the deadly opioid epidemic. Here's the toll it's taken. From 1999 to 2017, the CDC says opioids claimed the lives of more than 399,000 Americans. Anchor Kristen Hartman learned that stats like that have doctors and patients here locally looking for opioid alternatives. Kristen joining us live in studio tonight with a closer look.
Yeah, Craig, the CDC says the fill rate for opioids is actually way down. In 2012, this country saw 81 opioid prescriptions for every 100 people. Compare that now to 2018's 51 prescriptions for every 100 people. Much of the decline is doctor-driven, but a Mercy Health physician I spoke with says her patients are asking to handle pain in other ways.
Do you find that more and more people are coming in and saying, I don't want any part of opioids?
That's been the most impactful event that's happened, is that people don't want to be started on opioids.
Dr. Aarti Singla says they're requesting other pain-fighting strategies, and that's where she can help. Just ask patient Ava Strole. She's had back trouble since she was a kid. It meant surgeries and rod stabilization. Chronic pain was a way of life. So for more than a decade, Ava says she relied on a prescribed drug cocktail to give her the ability to do what she needed to do. But
were you worried about becoming dependent on the opioids?
Well, definitely. I mean, when you need that every day to be able to function, then you do.
And here's the thing, she was still in pain. Then came Dr. Singla, who she says made a difference.
I'm sorry, get really emotional because she has done more for me in the past 2 years, helping me to almost completely get off all the medications I was on.
Dr. Singla has a host of non-opioid treatments in her arsenal for a longer-term attack on chronic pain, including physical therapy and injectables like steroids. There's also platelet-rich plasma, or PRP, which takes platelets from your own blood to tackle trouble spots. And there's spinal cord stimulation.
So the leads actually go into the mid part of the mid-back.
Those leads, which you see in Ava's imaging, are surgically implanted along with a battery-type device that sends electrical pulses to the spinal cord. The objective is to interfere with or mask pain signals before they reach the brain.
What this does is it changes the way your body is processing that pain. It's been used more at end of the line, so when patients have failed everything, that's when people thought about using this. Now we're starting to use it earlier to bring people off opioids and to offer a more functioning.
Walking like this. You weren't able to do this before.
No.
And she wasn't able to pick up her grandkids. Now she can, and even has gone with them to Kings Island. That's her on one of the rides. She also permanently ditched the recliner she slept in every night for years. No need to elevate her legs anymore to take pressure off her back, so the chair is in pieces in her garage. And the prescription painkillers she says brought on
Mood swings, grogginess, brain fog.
They're gone too, and she tells us the side effects left with them.
And you're free of that now?
Yes, definitely.
Okay. And feeling fine?
Yes, I feel great.
Of course, this is a patient-by-patient, case-by-case kind of thing. Opioids still help people dealing with chronic pain. It's just now folks are talking about other options. Ava's physician specializes in interventional pain management, so they worked on solutions for her that were as meds-free as possible because that was important to Ava.
And as we've followed this epidemic, I mean, that really is the ultimate solution, is finding alternatives to the opioids.
And that's, we said it's doctor-driven,
Right.
but more and more patients are asking, how can I do this?
And that's the thing. That's the key. Ask your physician.
Talk
how
to
do we
your
do it?
doctor. See what works for you.